Փարիգուն Փոլորիտ, այսօր երկուշաբթի օր է եւ ինչպես գիտեք, ամեն երկուշաբթի 7:7 Dr. Harout Khanjiani ես եմ, California Eye Center. Այսօր պատրաստել եմ ցեզի համար շատ հետաքրքիր հաղորդումը, մեր ժամանակի հետ ավելի կապված եւ արդեն դուք գիտեք, հիմա արդեն ժամը 7 է եւ դուրսը արդեն 90 աստիճան դակություն կա, եթե 100 չերներ այսօր. Well, այդ դակությունը ամար է, բայց ադոր հետ վտանգներ կան, որ գուքան. So մենք այսօր ադոր մասին պիտի խոսենք եւ ավելի այդ վտանգները, որ մաշկային հետ, մորթի հետ, անգլերեն գսենք eyelid skin lesions. So այսօր իմ հետս դուք արդեն շատ լավ գիտեք մեր oculoplastic գոբի մասնակիցներից մեկը, Dr. Jordan Conger. Welcome, Jordan.
Thank you. Thank you for having me.
So I was giving a little intro here that it's about 7 o'clock right now, and it's already about 90, 95 degrees, and it probably reached about 100 today. And it's nice. It's summertime. You know, we had cold winters. We had a lot of rain. And now it feels good to kind of have a little bit of heat. But with that heat comes danger. And although we can feel heat, we can't see the danger of ultraviolet light. Ultraviolet radiation, which is invisible to the naked eye. But it can cause damage, and we already know what it can do with cataracts. It can accelerate cataract. It can lead and be one of the factors for macular degeneration. And also pterygiums, pinguiculas, which we've talked about. And now today, skin lesions. So we'll talk about that in a little bit. Ուրեմն արևին ջարակայդը ինչպես որ գիտեք, վնասական է, խոսեր ենք ասկի առաջ ինչպես cataract գրնա առաջարկե, գրնա macular degeneration առաջ բերե, եւ այսօր պիտի խոսենք աչքի մորթի վրա դեղեր, որ գարձեք որ խալեն կամ գտեսնակ տարօրինակ բաներ կան, որ գսկսին աճիլ եւ ադոնք վտանգավոր են կամ վտանգավոր չեն. So այսօրվա հաղորդումը ցեզի օրինակներ բիտանք, որ բացատրենք ցեզի որ մեկը վտանգավոր են, որ մեկը վտանգավոր չեն. Okay? So Dr. Conger, for our viewers, when you step outside and it's sunny like today, what are some of the most fundamental, basic things that we need to do to protect our skin?
That's a great question, and I think the number one thing you can do and add to your daily regimen is just putting on sunscreen. So SPF 30, 40 really is going to help protect your skin against the UV radiation. The other thing you can do is good eye protection. So sunglasses, really tinted lenses, are again going to provide another barrier to that UV protection. And then finally, as much as you're able to, wearing like a hat or limiting your exposure to direct sunlight are other critical things that you can do to your daily habits.
That's wonderful, wonderful tips. Now, a lot of our viewers are women, and our population likes to look young and not show their age. And a lot of times they like to be out in the sun and get a nice tan and this kind of doll up and look good. But getting that tan, they don't realize, actually starts to age their skin. So can you tell us how getting a tan like that is actually more harmful than beneficial?
Yeah, you know, it's interesting because you think that being out in the sun all day is going to make you look nice and bronzed and give you that really sort of glow that you're looking for. But actually over time, that accelerates the aging process. So every time you're exposed to that UV radiation, you're actually damaging the skin cells. And over long periods of time, it's harder for them to repair themselves, which leads to looking older, the fine lines, the wrinkles, the pigmentation you see on your skin. All these things can be accelerated by the UV light. And that is, again, why it's really important to protect yourself every day when you go out into the sun.
Thank you, Dr. Conger. I'll translate some of that. So, ուրեմն շատ անգամ գուզենք արևինդա գլալ, որ ասան քեղեցիկ բրոնզ քույն ունենանք, ամար ժամանակ է գուզենք քեղեցիկ հագուստ մահակվիլ, գարջ, քիչ փորերնից ցցնենք, you know. So, ադի քեղեցիկը նկարներն լավ գելեն հարգավ, բայց ադոր հետ վտանգ կա։ Մանավանդ at տանը որ գարնեք արևի, մորթետ գարակացնե իրեն դարիքով։ So ավելի դարիքդ կսկսի at մորթետ չի գրնար ինքն իր զինքը պաշտպանե եւ կսկսի ավելի մորթը ձերանա, դարիքը առաջ գալ։ գսկսի ջմրտկվիդ ժամանակով, գսկսի wrinkle-ներ երևի եւ գսկսի ավելի ձեր երևիլ, քան թե ուրիշ մեկը քո նույն տարիքդ։ So ադոր համար այո քեղեցիկ է քույնը, բայց նույն ժամանակ չի մորնակ տարիների ընթացքում մորթդ ավելի տարիքը գմեցնեք գործեր մորթին։ So ադոնք մեր հայերը տարիքով դադիկները արդեն գսկսին մազերը գործընծնեն, գքաչալանան, եթե տեսնակն է իրենց գլխին վրա, գտեսնակ, որ միշտ ասանք խալեր կան, պետք է հիշեք, որ տարիքով մազերը թափինն է, այդ պաշտպանական մազը չի գա այլևս, եւ որ տարիքոտ մեկը դուրս ելել է արևին տակ, ավելի վտանգավոր է իրենց, որով արևը ուղղակի իրենց գլուխին վրա գուքա, եւ տարիքոտ մորթ է, պաշտպանություն չունի, մազ չունի եւ մորթն արդեն պաշտպանական չունի, ուրեմն ավելի շատ թուրուն ցևով skin damage կրնան ունենալ եւ այդ skin damage-ն կրնա դառնալ մաշկային կենսերների, որ այսօր ադոր մասին պիտի խոսենք։ Okay? So հիշեցեք, միշտ գլխար քակեք, երբ որ դուրս ելեք SPF Sun Protection Factor 40, եթե ունիք քսեցեք դուրս ելեք, եւ եթե ունիքն է լավ արևի ակնոցը UVA, BC, 100% UV protection, շատ լավ արևի ակնոցը հակեք, որ աչքերնիդ պաշտպանեք, cataracts, macular degeneration, adank panerin herumenank. Okay? Dr. Conger, I know you took your time to prepare a fantastic presentation for us. These are all patients you've seen, and I know you're going to walk us through this. But before we kind of talk about what you have here, you're talking about eyelid lesions that can kill us and lesions that cannot kill us. Can you talk a little bit about what we're about to see?
Yeah, so first I'm going to just talk to you about some benign skin lesions, ones that you might see every day, ones that you might have noticed on your own skin over many years. But the other things that I think are very important for us to hit on are the dangerous lesions, the ones that actually can be life-threatening or cause a lot of damage to the local structures. And so if you don't address them early, it can really become a problem. And so the lesion that I wanted to show is just what we call a benign nevus or a mole. Same way that you can have a mole anywhere else in your body, this is just a mole or on your eyelid itself. This is an older gentleman who's had this lesion for many, many years, but he's actually had damage to the other side of his vision, and so because of that, he wanted to take extra precaution. He wanted to biopsy this to make absolutely sure this was just a benign process. Some of the things that I think really were working in his favor, you can see that there is no loss of eyelashes, the architecture of his eyelid is still normal. So my assumption was that this was a benign process. However, unless you do a biopsy, you can never be 100% sure. So with a simple biopsy in the clinic, with local anesthesia, we were able to take the entire lesion off, preserve the normal architecture of the eyelid, and reassure the patient that this was just a benign finding. Another common lesion that you can see is something called an acrocordon, or just a skin tag. You may have noticed these on your own body, usually around the neck or on the armpits, but these can also appear on the eyelids as well. These can be removed simply in clinic with a little bit of local anesthesia, but it's also important that you send these to the laboratory just to make sure. Every once in a while there is a little bit of skin cancer findings within these little lesions, and you want to make absolutely sure that we're doing the best we can to prevent any further damage.
Եթե ես ստուդիո գրնանքալ, այս մեկը որ հիմա ինքը ցեզի ցույց տվավ, շատ անգամ մեր վիզերուն վրա կտեսնանք։ Այստեղները միսի գդորներ գա որ գաջին, skin tag մենք կսենք ID անգլերեն, verruca is also a name that we call it. Sometimes these skin tags have viral etiology. Can that be?
Sometimes the ones that are more of a wart type appearance, a little bit different
like
than
a cauliflower.
Yeah, exactly. Those can be from a virus. These ones can sometimes be just from local skin irritation, especially if you have them along your neck or in your armpit region. It can be from diabetes and from other medical problems. But around the eyelid, usually they just cause a nuisance.
Got it. And these are usually no problem, but get it biopsied anyways, and it could be removed in clinic.
Very easily can be removed.
And you do this all the time?
All the time.
Because I know a lot of the Armenian population, they come in all the time and they say, doctor, I've got this one right here, and I got this one there, and I kind of hesitate to touch it because sometimes if you don't remove it properly, it can leave like a scar. So that's why I always say it's very important that an oculoplastic surgeon, someone like you, remove that so it doesn't ruin the aesthetics and the contour of the eyelid and other areas.
The other important thing is if you want to get the whole thing out so that it doesn't grow right back.
It can grow back, right? Okay, good. Video gërnank irtal.
The next lesion we have, this is a less common lesion, but one that I see quite often in my clinic just because these patients tend to come to me. This is a benign cyst, what we call a hydrocystoma. It's a sweat gland in your eyelid, and it accumulates fluid there. Now, this one's very important. Although it's benign, it's located very closely to the tear duct, where all your tears drain to your nose. And so one very important thing when you're removing these lesions is to know the anatomy and the surrounding structures to prevent any damage and other sorts of problems down the line. So you can see after a very careful removal of this lesion, it's completely removed, but the tear duct was not damaged and is completely intact so that there's no further issues with tearing for this nice elderly lady.
Yeah. I've had patients where they've actually said, doctor, I've got a needle and I just kind of poked it. The fluid that comes out, it's more like serous fluid, or is it more?
It is. It's sort of like this clear, kind of yellowish fluid that comes out. But the thing about that is, if you don't get the entire lining of that wall, the cyst wall, it'll just come right back.
So poking it at home with a needle is not a good idea.
Not a good idea, because in addition to that, you can also get infections. And I mean, these are critical structures around your eye that are responsible for vision. So, you know, an infection around your eye can be quite dangerous.
Yeah, thank you. I'll translate. Ուրեմն ադոնք որ ասանք թափանցիկ ուռուցք ունեցել են եւ դունը ասեղով փորձեր են որ պայթեցնեն, հիմա գիտեք դոկտոր Քանգերը գոբի մասնակետ բացադրեց ինչպես եթե ադանգնեկն է ինքը նորեն հետ կվերադառնա։ Շատ կարևոր է այսի երբ որ հանենն է at բոլոր structure-ը եղածին պես հանեն կամ at բջիջները մեջը մնան իդ նորեն գրնա աճի։ So եթե ունիկ շատ հեշտ, very simple in-office chair.
Very simple.
5 minutes, 10 minutes.
Chair, in-office chair. 5-10 minutes.
10 minutes. 5-10 minutes. Office մեջ նստած տեղը կմաքրեն կհանեն գերտաս. Would this be something covered by Medicare?
Yes.
Եվ վճարում աչիկա Medicare-ը լրիվ cover կրնանել, ասի եթե ցեզի հետ ասանք բան եղավ։ Okay? Good. Եթե ստուդիո վիդեո կրնանք երթալ։
Another common lesion that we see around the eyes is this sort of yellow deposits. You can see these on the upper eyelids and the lower eyelids. And this is usually due to cholesterol deposit. One thing that's very important is if you're a younger patient and you start to develop these, it's very important to actually check your systemic cholesterol because this can be a sign that it's very elevated and that your body's depositing it in this area around your eyes.
So sometimes I see them come in and we ask about cholesterol and they say, doctor, my cholesterol is borderline. I don't really have cholesterol, but they come in with these yellow plaquing. I mean, what would you say to something like that?
So I think it's important to check the cholesterol. If the cholesterol is fine, there's not really much you need to do about it. It's just part of where your body's sort of depositing the cholesterol.
So more likely around the eyelids for them.
It's more if you're a younger patient, 20s, 30s, and you're having this, then you really want to check to make sure you don't have a genetic problem that's leading to elevated cholesterol in your body.
Got it. Very nice.
And then one that we see very, very often, and I'm sure you see this all the time in your
Every
clinic
day.
too, is a stye or a chalazion. And this is just one of the oil glands of your eyelids becomes very inflamed and irritated. You know, usually we can treat these with medications. Sometimes we actually have to drain them in the clinic. So it's very helpful to get things on board very, early on. But if we need to drain them again, something that's very simple, easy to do in the clinic under local anesthesia.
Yeah. Եթե այս նկարը որ հիմա տեսակ մենք գսենք հայերեն օրինակ dignaglons անգլերեն chalazion stye ասոնք բոլորը այս գոբի ուռուցքի հետ գործ ունի Եվ ով որ արդեն դիտեր է մեր իմ կովս եկեր է շատ անգամ գրծեր է մասիցեզի օգնել, ով որ գրնա ինձի կալ, ասենք 2 շաբաթվա մեջ, որ ասի աջի, խմելու անտիբիոտիկ մը կա գրնանք տալ, որ եթե ադի խմես իմ ասած ժամանակվա մեջ, գրնա ասի անցնել։ Բայց եթե շատ երկար սպասեք, 1 ամիս անցավ, 2 ամիս անցավ եւ ասի չանցավ, այն ժամանակ արդեն կորզողությունի միջոցով մինակ պետք է ասի մաքրենք, որ գոբը պետք է փանան եւ պետք է հանեն։ So Dr. Conger, I was talking about, and I've said this before, if they can get to the doctor in a short period of time, I'd say within a week to 2 weeks, there is a chance with warm compresses and oral antibiotics, we have the ability to get rid of it. But if they come in a month to 2 months later and it's still there, then it's surgical, most likely.
Usually, if they're chronic, meaning they've been there for a long time, the body sort of scarred things off, and it's very hard to allow the medication to actually penetrate to get to that area.
Yeah.
So usually if it's been there for a long time, you have to end up surgically draining it. So the earlier you can get to it, the better.
Got it. Okay.
Now these next images, I've just put this disclaimer here, you know, if you're sensitive to anything graphic, just want to make sure that you're aware.
So the ones we talked about are just normal, benign eyelid lesions. They won't kill you. They're there, you know, and they can be treated. But the ones we're about to talk about
are the dangerous ones.
The ones that can kill you. So ասոնք որ հիմա մենք պիտի խոսենք դրա մասին հիմա նոր, ասոնք աչքի մաշկի խնդիրներ են, որ ավելի կենսերների հետ կապ ունին եւ գրնան ասոնք ցեզի մերցնել։ So եթե դուք ասանք փամ ունիք եւ ժամանակին չփուժեք, գրնա ինքը տարածվի, գերտալ լիմֆնոդների կամ օրբիտի մեջ կանցնի ուղեղին եւ գրնա այդ աչքի մաշկի խնդիրը քեզի մերցնե։ Ուրեմն ասոնք հիմա որ պիտի խոսենք դրա մասին ենք։ Ադոնք որ խոսեցան այս ասկի առաջ, ադոնք ավելի benign են, վտանգավոր բաներ չեն, բուժվելիք բաներ են, բայց կենսերների հետ կապ չունի։ All right?
So these are the ones that, just going back to our earlier conversation, the sun protection against the UV radiation, incredibly important. So this is a 50-ish-year-old gentleman who had this lesion growing on his lower eyelid.
Like black spots, like somebody got a black pen and just...
And so it's sort of this sort of heaped up, kind of pearly kind of lesion that looks atypical, thickened skin. And sometimes they can bleed, sometimes they can become very irritating. Now, you can tell that this lesion right here, the size that it's showing outside externally compared to how much actually had to be removed that had cancer was quite different. And then we had to do a lot of reconstruction with skin grafts and a lot of things to get to rebuild the lower eyelid. But so the earlier you catch it, the better it's, the more likely you're able to cure it, get the whole thing out, and prevent worsening outcomes.
Fantastic. Okay.
Again, this is another same type of skin cancer, basal cell carcinoma, where you have this area on the lower eyelid that sort of looks, the skin looks abnormal. There's changes there. And so we did a biopsy that actually showed that it was this type of skin cancer. We were able to remove the entire thing and then reconstruct the eyelid to fill in the defect. And this was about a week afterwards, and you can see that it fills in the defect very nicely. And because we caught it early, we were able to cure this guy of his cancer.
Yep.
Moving on, these are some a little bit more serious, more dangerous types of skin cancers, the squamous cell carcinomas. And this, you can see that there is this growth on the lower eyelid. And, you know, this was present for many years and wasn't really changing that much, but all of a sudden one day he decided to get it checked out. This area was actually an invasive squamous cell carcinoma. And so we had to take out this entire section of the eyelid to really make sure we got the whole thing out. And then with some reconstruction, we were able to bring his eyelid back together, and it looks like brand new, like nothing even happened. And we were able to cure him of his disease with no other body, cancer anywhere else.
Wow, great job on this one. Great job.
Again, another example, the squamous cell carcinoma. And the reason why I wanted to show this again is because just like the last one, it showed that there's this little bump here, but really look at how much had to come out down here, a very large portion of the lower eyelid had to come out. So sometimes it is actually hidden underneath and you don't know until you start looking at it under the microscope. And then with some reconstruction, a couple of weeks later, after reconstruction with skin grafts, we're able to rebuild the eyelid and get things back into normal position. This is important not just for the appearance, but also to protect the eye. And then this gentleman, I wanted to show a very extreme example because, again, like we were talking about, it's important to make sure you catch these things early to make sure that it doesn't get too advanced.
Like if I saw this, I think that he has like a little bit of a rash here, maybe give some erythromycin ointment, maybe he had some kind of an allergy. I wouldn't really think much that there's something dangerous underneath here.
And I think it was the chronicity and the fact that nothing really made it better is when you say, hey, there's something else maybe going on here. And so a biopsy showed, again, this squamous cell carcinoma. And this much was involved.
Wow.
Excuse me. And so again, this shows very important to catch these things early. Excuse me. With some reconstruction.
Yeah, all right. So I can see here how much of actually was hidden underneath in there, and we had like no clue. I mean, look at all that area that had to be removed just to be able to clear that stuff out. And then here you can see on the right, after the reconstruction, once all that was removed and reconstructed back, and he's back on his way.
And this is about, excuse me, this is about 3 weeks later, where you can really see the skin is thickened. So sorry.
That's all right. So I do see this area here with some light scarring, and it's like thickened in.
Thickened in, and that's just the body sort of healing through the process. Thank you.
Right, and so eventually it will kind of blend in. And
eventually this will all blend in and heal up very nicely. But again, the sooner you catch this, the less likely you'll need to have such big reconstruction.
Got it. So yeah, this is գտեսնակ այս նկարի մեջ ինչպես այս աչ կողմը հիվանդ մնե որ չեք նկատեր որ գրնալալ at կարմիրության տակը խնդիր կա կգարձեք որ maybe allergy կա կամ maybe քերեր է ձերքով կամ maybe infection կա բայց այդ մաշկին տակը չեք կրնար պատկերացնել ինչպես տակը cancer գա որ գաջի գոր եւ այդ cancer-ը եթե ժամանակով չի հանեն չի մաքրեն գրնա ինքը տարածվի երթա լիմֆնոդների երթա ուղեղի եւ աս մարդը գրնա աս մաշկի խնդիրով մեռնի ուրեմն գտեսնակ այստեղ շատ լավ օրինակ է ինչպես եթե դարօրինակ փամը նկատեր եք ձեր մորթին վրա մաս մգա որ քույնը սկսեր է փոխվել կամ մաս մգա որ բանը որ ունեցեր եք տարիներով սկսեր է մեծնալ ադի նշան է որ պետք է քակ բժիշկիդ եւ ադի պետք է բայապսի լա որով գրնալա դագը cancer կա.
And so he was very lucky because, although it's widely spread on the outside, there was nothing that spread inside of the orbit.
Wow.
These are some other types of skin cancers, more dangerous, the ones that can actually kill you. And
These are go down into the melanoma, also sun-related, you'd say, on these ones, right? So
exactly.
Importance of sunglasses, UV protection, for sure.
Mm-hmm. And then finally, these are ones that are very, very rare, but ones that we always want to make sure are not going on. Sebaceous cell carcinoma and Merkel cell carcinoma, these are ones that actually can kill you. And so biopsying, always very important. And biopsy can be done very easily in the clinic. We can do it under local anesthesia, and then we know exactly what's going on to prevent, so that we can, appropriately treat what's needed.
Got it. Wow, fantastic. This is wonderful to share. I'm happy a lot of our viewers get to see this and learn the importance of UV protection. Sunglasses, hat, SPF 40. All of it is very important. Ամենը շատ կարևոր է, արևը շատ վտանգավոր է, միշտ մենք մեզի պետք է պաշտպանենք։ Եթե ասանք problem ունենք, կրնանք մենք բուժել։ Մենք գոբի մասնակետի բաժին ունենք, որ աս բուժումները բոլոր գնենք։ Thank you, Dr. Conger. Pleasure having you on. Քիշեր բարի բոլորիդ, կալ երկու շաբթի օրը